Yeah, my name is Paul Murphy, from the Republic of Ireland.
My name is Yvonne Murphy, his wife from Republic of Ireland as well.
I'm here because of health problems, that has to do with Parkinson's disease. I suffer from Parkinson's disease, and I'm here to get it treated or cured if possible. I was diagnosed in
2013.
2013.
End of 2012, early 2013. He was diagnosed. Then it seemed very mild. His symptoms then, even though we didn't realize, he was beginning to slur in speech. His movement was very slow. He was tired all the time. He even fell once or twice, and we didn't know. So we had to get him to the hospital through the ambulance one of the days. And at the time, they weren't sure what it was. They were testing for thyroid, testing for different hormones that were testable at the time. But I think around March or April of 2013, they were definite it was a neurological disorder. And then by June, July, August of the same year, they started giving him medication for mild Parkinson's at the time. But he was still able to, move around, even though with a bit of problems. By 2016, the sickness was full blown, really blown. He became incontinent. His prostate was enlarged. His blood pressure shot up. He was tired. He started cramping, stiffness, dyskinesia. Tired mostly all the time. He wasn't able to do anything much for himself. So he stopped work, stopped driving, stopped pretty much doing anything. And then from that 2016 up until now, we've been trying different combination of medication, different treatments, both from here in the Western world and but from Nigeria and Africa, where I come from, and America. So we've just been going round and round, with the consultants up until this very moment that we're here in Swiss Medica. Yeah. There's treatments that they call this the stem cell treatments in capsules that we have tried. It's like supplements. I can't remember the names, so don't, but we've tried a couple of them. They're from all these companies like Juice Plus and Forever Living, and a few of them like that. And we have friends who would be distributors of the product, and they would come across issues that would say, okay, when you take this and take it for some time, that the supplements should be able to reduce either the progression of the disease or entirely cure it, and so we try. They would say, buy this one is okay, we'll do that. They would say, get this one is okay, we'll do that. There's even one we got, Paul, what's the name of that one we got from America last? I can't remember. There's another supplement like that, and they're not cheap. I mean, like all these supplements have their stuff. And then we'd also try back home in Nigeria, we'd try herbal therapies, made from people who are into alternative medicine at home. He'd be asked to drink this, he'd be asked to massage this. So we tried all that as well, and there's no result. The disease kept progressing, So yeah, and then with the consultant as well, we'd try. We've tried to do the brain stimulation, deep brain stimulation. We tried to do that, but his condition had progressed so much that they didn't want to tamper with his memories. It'll endanger his memorial membranes the more.
They
We
literally have actually tried,
the preliminaries.
the dopa, dopa or whatever, and all the dopas, they've tried, through consultant in the hospital. So those have not, they've only been able to reduce the symptoms of the illness over time. And then
You tried the apomorphine? Is it
tried the
apomorphine?
apomorphine,
Yeah.
tried duodopa, all the dopas, So none of them proved to be, they were very, really very effective with reducing the symptoms, but the illness was basically still there. So, and that leads one to want to look for alternatives, which she explained earlier on. I had to, now that the illness was becoming too difficult to contain, I thought, there was a need to look for alternatives, because I wouldn't continue. I didn't see myself, going on with the illness the way it was going on. It's been very difficult to contain it. I suffer from dyskinesia, which is very painful. I also suffer from hallucinations, from the drugs, and then
Cramping.
cramping,
Enlarged prostate.
yeah, other
Stiffness,
illnesses came along the line,
high blood pressure, all of them. He actually spent a lot of time, to be honest, in the research, because he had all the time. There was nothing else he could do but to just sit. He was searching from one website to the other, one internet, making phone calls and all that, and until he came across Swiss Medica. He came across this clinic and sent out the form to them, and the clinic contacted him back, and then he told me about it and said, "Look, they've contacted me. What do we do?" So we set up an appointment. Well, then it was online. Everything is online. So we set up the online discussions with them. Told them about Paul's history. He's had it 10 years now going. They asked about the symptoms, the medication he's taken. We gave that to them. And at the end of the day, they felt that he had a chance at stem cell treatment. He had a chance to see if that could at least improve his quality of life. It may not cure it, but we pray maybe it does. But at least for me, it would be good for him to have a better quality of life, because he doesn't sleep well some nights. He's stiff most of the time, even with the medication. It might work the 4-hourly, it might not work. So you're not even sure what to expect each time he takes the medication. And then his prostate is enlarged, his bladder condition is very bad. So sometimes there's urgency to wee. Even when that urgency to wee is there, it might not come. So he has all this pain under his abdomen and all that. Sometimes he's so tired, sometimes he's mentally not there, So for us, if this stem cell treatment can give him a chance at reducing at least, even if it's 50-60% of all these symptoms that he seems to be suffering for a period of time, until he grows old, whatever. It's a good embracing. It's good to try it out. So that's why we're here, giving it our best thoughts and our best hope that it's going to work. It's going to, we're told not to expect anything, maybe until 3 months, maybe from 3 months to start seeing, hopefully, some improvement in his in symptoms, so that is what we're praying for. The initial thought when we discussed with them was that they were going to take a bit of Paul's stems as well to mix it with the donor cells. But on arriving, with much assessment and everything, Paul's condition had gone so bad, 10 years of Parkinson's, 10 years of treatment, different medication and all that. The doctors felt that it's better to just use the donor cells for him as fresh, so that there's no contamination, there's no excuse that something happened somewhere. So we're hopeful that with what they're doing, it's going to work. Mm-hmm. Yeah. Well, like every other thing, you wouldn't want it to cause alternative damage to his cells. You wouldn't want it to go where it's not supposed to go, in the treatment. And overall, you wouldn't want it to be negative in the terms that all this process has been for nothing. So the worry would be that it didn't work. The worry would be after all this and after all the money being spent and everything, Paul's life, his conditions, his quality of life hasn't changed. So that is the greatest fear with the stem cell. For it not to cause more damage and for it not to be a negative in terms of not working. So those are the two major fears that we would have in this treatment, yeah. Anyway, starting from the airport, from the pickup, the patience and the waiting, because when we arrived, it took a bit of time for us to get down to our arrivals and our luggage and everything, because there were so many people, the OCP people that, the wheelchair guys had to take down from the aircraft. So the dispatch people, the admin or the operations, I don't know what to call them here, they were very patient. They were very nice. They still are. And they took us from the airport to here, made sure that we were properly welcomed, properly accommodated, like brought us to our accommodation and all that, asked us what we wanted to eat from the kitchen staff and all that. And then we met the health staff, the healthcare staff. I think they blew our minds away. They were so caring, they were so nice. And the doctor, a specific doctor, I mean, I know they know who they are. I mean, the knowledge, the experience, everything that came with our discussions with them, fantastic. Like that put me, myself, I don't know about Paul, it put me, myself, my mind at ease that you were talking with an experienced person. The advice that was given, the combination of medication that was suggested, the removal and addition, the length of time, the expectations, what we're going to see, what to expect, in terms of what the medication will do. Maybe he might be tired, the blood pressure might go up, so you kind of know when something is happening. Oh, we were told this might happen. We were told this will happen. So you're not panicking. You're not, So that was fantastic. And then you come to the physiotherapy. I even got some because I came with a bad finger. They were brilliant. They accommodated me with Paul. He got, sometimes even when we're late, they'd have to come and get us, So they knew when to come. They knew how to come. They knew, and then, kitchen staff, welfare, housekeeping, everything from beginning to end, to be honest. I cannot complain. I can't complain. They'd ask you even they want to do more. For me, they've done much more, but they want to do more. So, yeah, it's so proud of the staff here. So proud of the staff, and my appreciation always. Paul, you want to say something?
Yeah, it's you said it all. It's nice to know that there's an institution, out there which can take your matter to the, from beginning to end. Take your conditions and then manage them. So I think it's a plus. It's a plus to have such quality of staff, in one's terrain. So that's it. I don't think it's painful. Initially, one may be thinking that when you're given the treatment that you're going to face severe situations that will make you pass through pains and all that. But for me, it's a different experience entirely. Except for
trying to find your veins.
except for locating those veins. It's really simple, easy to do. To know that it's an infusion that you go through, and not
surgery or something.
Not surgery. You are not passing through. You're not passing through cutting your skin.
Any invasive procedure.
So it's
And the good thing about the quality of staff that he was talking about, once the nurses got to know his problems in finding veins for the blood, they knew. They understood his body system. So they're now able to just locate that vessel, locate that vein, and give it the necessary push that it needs to give them either blood or the tint that is needed for the infusions. So yeah, to be honest, when we were coming here, I had no idea what to expect in terms of the stem cell treatment. We didn't know what the procedure was. We didn't know how it was going to be. We didn't know if it was going to be put to sleep or he was going to enter a machine or whatever. So with the experience that we have here, it was quite a simple method of treatment, and the doctor and the nurses will talk you through it as it's happening as well. This, we're going to do this today, blah, 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 and then we'll see how that is. And then for here, I've learned parameters. We don't say parameters back in Ireland. It's more like obs, your observation in terms of your blood pressure, your pulse, your what's the other one? Your temperature and all that kind of thing. We're not used to saying parameters. So I've learned parameters here. So I'm going to be using that when I get home, your parameters. So they always check the parameters with Paul, which is good, just to see that everything is on the check. And when they feel that either his blood pressure is too high or too low, they stop the treatment and wait for him to get back, then start again. So it's a very nice, assured sort of treatment for Paul, for stem cell here. Even though I realize that around the world, like the likes of United Kingdom, the other part of Europe, and maybe America and some part, they still have this fear of stem cell treatment not being properly either regulated, properly researched, success stories not so much there and all that. But in life, there's always risks. You have to take certain risks to actually grab what you think you can grab. So if you don't do that, you'll be wallowing in if I had known situations. So this was a big jump. It was a big leap of faith for us to try. And we're hoping most seriously that that leap will be successful. I think people who have health issues that on the spot medication has not been able to help for the years, depending on how long they've had it. I think stem cell treatment is something that they can consider. You know, I know it's very expensive at the minute, but for us, we were very lucky to have friends and family who have supported us through this past few months in trying to raise enough money for this treatment. You know, they have been fantastic. You know, I just don't know. We want to thank them. We want to use this opportunity to thank them all so very much and show them our heartfelt appreciation, you know, for the care and the love, the support, the encouragement, the prayers that that have been coming our way through them. It's been massive. So if people who have gone through or who are going through these medical conditions and they think that stem cell treatment is the way to go, it's possible. It is possible, you know, to do. And hopefully you'll be at the other end and say, thank you, thank God that I did. You know, so I would be encouraging people to look into it very much. Yeah, thank you.
Great.